Hi everyone, how are you? Welcome to another question and answer session. This is the physiology question. A 45 years old man sustained a closed head injury. He initially alert, however, his level of consciousness deteriorated on arrival on the hospital. An intracranial pressure monitor is inserted. What is the normal intracranial pressure? So it is the direct question that what is the normal intracranial pressure. Here the options are 35 to 45 millimeter mercury, 45 to 55 millimeter mercury, less than 15 millimeter mercury, 25 to 35 millimeter mercury, and 25 to 30 millimeter of mercury. So we have to find out one of the option which is the normal intracranial pressure, and it is the direct question. So first of all, let's see the intracranial pressure. Here we can see the different type of the ventricle in the brain, and there is the different type of ventricles such as the lateral ventricle, third ventricle, and fourth ventricle. Different type of ventricle present and CSF present, and the intracranial pressure, it is measured by the difference of three important parameter. So first of all, the ICP, that means the intracranial pressure. It is total pressure exerted by the three component within the skull, such as the systemic blood pressure, CSF pressure. So this type of pressure is very important to measure intracranial pressure. And there is important hypothesis that Monroe-Kelly doctrine, which are not required for this question, so skip this. See the ICP, that means intracranial pressure. So the normal range of intracranial pressure, it is between the here we can see 7 to 15 millimeter of mercury, and brain can accommodate increase up to 24 millimeter of the mercury. Therefore clinical feature will become evident. That means normal intracranial pressure, it ranges between the 7 and 15 millimeter mercury, but when it exceeds more than 24 millimeter mercury, then clinical feature develops. So normal intracranial pressure 7 to 15 millimeter of mercury. Here we can see one option present which is less than 15 millimeter mercury. It is the normal intracranial pressure.